Hello dear friends, I Dr. Shamsher Singh welcome you all to my Pharma Learning channel. So you can like, subscribe and watch all the videos. Today I am going to discuss with you about the next GPAT series. Hope that will be very useful for you all because this series also contain a number of tricks and the new tricks has been added. So that will be very useful for the GPAT exam. So going to the first question, the first trick. Tamoxifen cross blood-brain barrier. Tamoxifen means 3B. So it has reduce resorption in the bone. Second B, it reduce the carcinoma, that is breast cancer. And third is in the blood, it increase HDL and reduce the level of LDL. So tamoxifen is reported for 3B. The next question for the GPAT series in the Pharma Learning channel is preconceptional intake of which of the following result in decrease in the incidence of neural tube defects. The options for this question are vitamin A, vitamin C, folate and vitamin E. You can choose the correct answer for this question. The correct answer for this question is folate. So that means during the early time of pregnancy, if folate we administer to the females, then the babies will never be suffer from neural tube defects. Also, if there will be availability of option like vitamin D, so vitamin D also reduce this neural tube defects, it has been reported. So this is a correct answer for this question. The next question for the GPAT series is posterior column sensation in the lower limbs are lost in. The options are vitamin A deficiency, vitamin B12 deficiency, vitamin C deficiency and vitamin deficiency. So you choose the correct answer for this question. The correct answer is vitamin B12 deficiency. So you know that vitamin B12 is reported to improve the neuronal health, neuronal activity, increase the myelin sheath synthesis, and that's why the vitamin B12 deficiency sometime cause you can say pin pricking like sensation, or you can say posterior column sensation in the lower limbs. So this is a correct answer for this question. The next question of this series is the most appropriate drug used for chelation therapy in beta thalassemia major is. The options are oral desferrioxime, oral deferriprone, intramuscular EDTA and oral succimer. So you choose the correct answer for this question. In case of thalassemia, the correct answer is oral deferriprone. This deferriprone is used as a chelation therapy because whenever we know that there is a excessive accumulation of ferritin. So this ferritin, whenever it is excessively accumulated, it is reduced by use of oral administration of deferriprone, and it causes chelation with that, complex formation with that. So that's why this is a right answer for this question. The next question is iron is most commonly absorbed from. The options are duodenum and upper jejunum, lower jejunum, stomach and ileum. You choose the correct answer for this option. The correct answer, the correct option for this question is duodenum and upper jejunum, because you know that in case of stomach the pH lies around 2.2 to 4.5, but whenever we move near to the duodenum and early part of the proximal jejunum, the pH is slightly basic as well as acidic. So it lies approximately near to, you can say, 5.6 to 6.4. At this pH around 6, the absorption of the iron from the duodenum and upper jejunum is high. So this is a correct answer for this option. The next question is, which of the following drug does not act by blocking GP2B3A receptor? So the options are F60mab, aptifabetide, clopidogrel, and tirofiban. So these are the option. You choose the correct option for this question. The correct answer is clopidogrel does not act by blocking GP2B3A receptor, because this GP2B3A receptor are present on the cell membrane of the platelets, and that's why some of the drugs, by acting on this receptor, reduce the platelet aggregation, but this clopidogrel act by PA2 type of receptors. So that's why clopidogrel is the right answer for this question. So the next trick is adverse effect of valproic acid, which is used as an anti-epileptic drug, anti-seizure. So V indicate vomiting, A indicate alopecia. Now the alopecia side effect of valproic acid, because it reduce the, you can say, the increased growth of hair follicles, as well as reduce the blood supply, oxygen supply to the hair follicles. Liver damage, pancreatitis, skin rashes, obesity, agranulocytosis, tremors, and epigastric pain. So these are the adverse effect of the valproate. So the next question for this series in the Pharma Learning channel is, all are antiplatelet drugs except, options are clopidogrel, abciximab, aprotinin, and ticlopidine. So the right answer for this question, you can choose or comment in the box. The right answer is aprotinin. Aprotinin is not a antiplatelet drug. So all these clopidogrel, abciximab, ticlopidine, they act by inhibiting GP2B3A or PA2 type of the receptor, which are present on the platelet. Even though this aprotinin is a, you can say, antifibrinolytic, antithrombolytic, but it act by some other enzyme like serenase and other enzyme in the body. So the next question is, drug used in heparin overdoses: protamine sulfate, phylloquinone, ticlopidine, and clopidogrel. So you choose the correct answer. The correct answer for this question is protamine sulfate. So this protamine sulfate is used in case of overdose of heparin, and you know that it is used at a dose of 1 mg to 4 mg, and at a dose of 1 mg it can neutralize 400 units, international units of heparin. So this is equivalent that 1 mg of protamine sulfate can reduce the overdose toxicity of 400 international unit of heparin. So this is a right answer for this question. The next question is, which of the following is not used for thromboprophylaxis? The options are heparin, warfarin, antithrombin 3, and aspirin. You choose the correct answer very fast. The correct answer is antithrombin 3. So this antithrombin 3 is not used in this case, because antithrombin 3 can, you can say, cause antithrombolytic or fibrinolytic effect, thereby it can increase the thromboprophylaxis. So that's why antithrombin 3 is the right answer for this question. The next question is, low molecular weight heparin is preferred over a unfractioned heparin because the options are low molecular weight heparin directly inhibits thrombin, whereas unfractionated heparin act via activation of antithrombin. Low molecular weight heparins have lesser risk of causing bleeding. Low molecular weight heparin can be given subcutaneously as well as orally. And low molecular weight heparin has consistent bioavailability. So you choose the correct answer for this. The correct answer is low molecular weight heparin has consistent bioavailability because this is the problem with unfractionated heparin, because unfractionated heparin is having a low bioavailability and its little bit overdose can leads to various side effect in the body. So that's why this is a right answer for this question. The next question is, which of the following drug is not recommended in septic shock? The options are normal saline, activated protein C, rituximab, and steroids. You choose the correct answer. The correct answer for this question is rituximab is not recommended in the septic shock because rituximab is a one of the antibody. If you will administer this antibody in this case, it can increase the hypersensitivity reaction and leads to increase in the infection in the body. It increase the infection, so promote the infection. So that's why in case of septic shock, severe infection, never recommend rituximab. It is a right answer. The next trick is disulfiram-like reaction is caused by cyclic GMP, chlorpropamide, ceftriaxone, griseofulvin, metronidazole, moxalactam, and procarbazine. So this is the drug which cause disulfiram-like reaction. So what are disulfiram-like reaction? The disulfiram-like reaction means this disulfiram is a drug which is used whenever you want to stop the alcohol intake. So it is a aldehyde dehydrogenase inhibitor. So disulfiram mean hot flushing, slight increase in the body temperature, muscle twitching. So these are the some effects which you can see in the body. So these drug produce this type of effect in the body. So the next question is, the effect of thiopental on the CNS is quickly terminated by, the options are rapid metabolism in CNS, quick first pass elimination, redistribution, and rapid metabolism in the systemic circulation. You choose the correct answer for this question. The correct answer is redistribution. So this thiopental sodium is redistributed in the CNS because of its lipophilic nature, and this thiopental sodium sometimes produce shivering in the animal. So thiopental is one of the anesthetic which is preferred in the animal for the major surgery, or if you want to do surgery of any organ of the rat. So this is a thiopental sodium. The preferable dose in animal is approximate 80 to 85 mg per kg intraperitoneally. So this thiopental sodium is used. The next question for the GPAT series is, in which of the following disorder administration of barbiturate is contraindicated? The options are acute intermittent porphyria, anxiety disorder, Kernicterus, refractory status epilepticus. You choose the correct answer or comment in the box. The right answer is acute intermittent porphyria. So this barbiturate is not preferred in this case, acute intermittent porphyria, because this barbiturate, they are having a sedative property and they are, you can say, muscle relaxant. So that's why they are not preferred in this case. This is a right answer for this question. And barbiturate, they are the anti-epileptic, you can say antidepressant type of the drug. The basic mechanism of barbiturate, they act by opening of GABA channel. And by opening the GABA channel, they cause hyperpolarization, reduce the nerve conduction velocity. So these are the barbiturates. So next, peripheral vasospasm is observed with which of the following anti-Parkinson drug? The options are ropinirole, levodopa, bromocriptine, and entacapone. You choose the right answer for this question. The right answer is bromocriptine. So you know bromocriptine and pergolide, they are the decarboxylase inhibitors which are used along with the levodopa to increase its blood-brain penetration power. And if you will give a bromocriptine, it can cause vasospasm in the periphery because it increases the level of dopamine in the peripheral side. So increase in the level of dopamine, little bit increase the heart rate and increase the vasospasm. So this is a right answer for this question. The next question is, which of the following drug used for transcranial patch for Parkinson disease? The options are levodopa, rotigotine, salicylene, carbidopa. You choose the correct answer. The correct answer is rotigotine is a right answer as a transcranial patch for Parkinson in case in case of early Parkinson disease or late Parkinson disease more, this patch is used. Now this patch will contain a drug rotigotine and it release the drug for 24 hours. So there is a no need to give a long term administration of drug morning, evening like that. So you apply the patch and this rotigotine patch in the more in the later stage of Parkinson, at the end stage Parkinson, this can release a slowly drug through the cranial, you can say, patch for 24 hours. So this is a right answer. The next question is, which of the following, if combined with rivastigmine, decrease its efficacy? Selective serotonin reuptake inhibitors, reversible inhibitors of monoamine oxidase A, tricyclic antidepressants, and atypical antidepressant. You choose the correct answer. The correct answer is tricyclic antidepressants, because these tricyclic antidepressants, they are the enzyme inducers, and these antidepressant drug, they basically increase the metabolism of rivastigmine and thereby interfere with the efficacy of the rivastigmine in the body. So this is a right answer for this question. So this is a trick, that is lidocaine toxicity. ANS mean autonomic nervous system mean. A indicate agitation. This is a lidocaine toxicity. Lidocaine is a local anesthetic, act by inhibiting the sodium channel. So N means nervousness, that is CNS related symptom. S means seizures. M means muscular twitching. So in the short trick you can remember lidocaine toxicity ANS mean. So this is the trick for you. You can remember this type of symptom of lidocaine. Next question is, gender specific adverse effect of valproate is weight gain, tremors, alopecia, polycystic ovarian disease. You choose the right answer for this question. Gender specific adverse effect of valproate. The gender specific valproate effects are polycystic ovarian disease in the females, because this valproate in the some of the female has been reported that it interfere with the release and working of the androgens. So whenever it interfere with the female hormones, the chances of the polycystic ovarian disease are more, because it is reported that valproate also cause disturbance in the menstrual cycle in the females. So this is a right answer for this question. So next question for this GPAT series is which is a treatment of juvenile myoclonic epilepsy in pregnancy. So pregnancy associated epilepsy during the early stage, the options are levetri, levetristum, next is carbamazepine, vigabatrin and phenytoin. So you choose the option. The correct option for this is levetristum is the right answer for this option, because you know that this drug, if you will use at the early phase of myoclonic epilepsy in pregnancy, it is not necessary that you should care about the toxic effect of this drug, because this never produce a more toxic effect. It is a safe as per the therapeutic window. That's why this is the right answer for this question. The next question is maximum dose of lignocaine give with adrenaline for infiltration anesthesia is. The options are 3 mg per kg, 5 mg per kg, 7 mg per kg, 10 mg per kg. You choose the correct answer. The correct answer for this question is 7 mg per kg. So lignocaine along with adrenaline we always use at a 2% solution. So I, with the ratio of 1 ratio 1 lakh, so you know that the dose should be, lignocaine should not be more than 7 mg per kg, because if you will use a higher dose of lignocaine, it can produce various toxic effect in the body like respiratory depression, cardiovascular depression, CNS depression, like that. So this is the side effect. So this is the maximum dose you can use. So even though preferable dose is 2% of that particular solution. The next question is methemoglobinemia is caused by prilocaine, ropivacaine, bupivacaine, procaine. You choose the correct answer. The correct answer is prilocaine cause methemoglobinemia. This is because it replaces the hemoglobin concentration in the RBC and responsible to cause a methemoglobinemia. So prilocaine is the right answer for this question. The next last question is first local anesthetic used in the clinical anesthesia was lidocaine, cocaine, procaine, and bupivacaine. The right answer you can choose for this. Right answer is cocaine. Cocaine was the first local anesthetic used because from the cocaine other derivatives were derived like procaine, bupivacaine, lidocaine with a more safe range and with a better therapeutic window. So procaine is the right answer. The last trick for this GPAT series in the Pharma Learning channel is use of bromocriptine, that is diabetes mellitus 2, dopa, that is bromocriptine cause diabetes mellitus 2, over secretion of prolactin, Parkinson, acromegaly. So these actions of bromocriptines are, this is due to interference with the dopaminergic D2 receptor, because you know that whenever you will give a, you can say, any antagonist of D2 receptor, like you can say this domperidone, which is an anti-emetic drug. So domperidone never be administered in case of pregnancy. The reason is domperidone can block D2 receptor and increase the chances of Parkinson in the newborn baby, interfere with the prolactin secretion, and acromegaly can be there. So hope this GPAT series in the Pharma Learning channel was very useful you all. So you can also comment in the box. So you can also watch, share and like all these videos. Hope in the coming time we will provide you more better video for your GPAT exam from the different section, from the different subjects. So you are welcome. Thank you very much.